Hey, Black Lions and Black Lions families, Colonel McGinnis here, Line 6. Wanted to take a few minutes to share with you our current situation and what we're going to do to more aggressively get after mitigating COVID-19 in our formation. So first I want to say we've got several soldiers out there right now that have tested positive, and my first message to you all is I wish you all a speedy, quick recovery as you get through this. And of course, anyone that has a need, don't hesitate to reach out to your chain of command, and we will do everything we can to help fulfill that need. So for all of our soldiers and potentially some family members out there that are currently positive, I wish you, Sergeant Major and I wish you a speedy recovery. So I want to kind of take a few minutes to explain current situations and how we're going to kind of aggressively get after this. So going back, and first of all, I want to say that just to remind you that all the stuff I kind of talk you through here, I'm not going to use specific numbers. So Army put out, the Defense Department put out back in, I think, April to not discuss specific numbers. So I'm going to do my best to kind of explain the challenges that we're in right now, but also not try and overblow the situation. I mean, we've got some challenges, but we're not necessarily in a really truly bad spot at this point in time, just looking at our total numbers. And so anything I kind of talk through and show you up here doesn't represent actual numbers. This is kind of just generalities and depictions. So real quick, I kind of want to start with here is this little chart, right? So I got cases and I got time. And so this goes back and it represents March. And so right back into when we first went into our task force restriction of movement, which was before General Order Number 1 came out for Fort Benning or Fort Stewart, we recognized that we had a possibility of bringing COVID-19 into our formation and developing a cluster. And so we reacted pretty aggressively early on. And the good news is that work and the discipline that our soldiers and many of our family members demonstrated absolutely worked. And going back to March, April timeframe, very small number of cases. And those cases were directly attributable to a family member that had been in a high-risk situation in terms of potential exposure to COVID-19. So quickly identified it. We took a lot of aggressive measures up front, and for a long time, really, starting kind of in April, we were riding zero for a long time. And then last week, as you can see, this is kind of what we look like starting in the last 7 days. All right, it is absolutely into our formations now. Of our 8 companies, 7 have at least 1 case, and then a couple companies have more than 1 case. Okay, so it's not a particular company problem; it's a task force problem. And I kind of want to explain how we're kind of framing this problem set, right? So first of all, there's kind of 2 ways to look at how COVID comes into our formation and potentially how it moves around. All right. First is what we call clustering, right? And so let's say this is a squad, right? And so you see a little black dot represents a soldier, little red circle around represents a positive case, right? So if a squad or a team starts to have a couple cases, we call that a cluster. Okay. Once we've identified that group or group of positive personnel, service members, it's pretty easy to contain that through the seclusion and quarantining of cohorts. And so since we've returned back to training, we have worked diligently to make sure that no more than a squad size element, and generally speaking we're looking at about 10, are operating in and amongst themselves. Now even if they're a cohort, right, the expectation is they're still maintaining that greater than 6 foot physical distance. We've done a lot of things in terms of training, transporting troops. We're doing that in the back of vehicles at half capacity. So if the capacity for a vehicle is 10, we're only putting 5 in there, and then once they're in that kind of enclosed space, they're supposed to be wearing their mask. Okay, so we've taken a lot of prudent steps, CDC guidance, as we've returned back to training. So in a cluster situation, we potentially have higher cases initially, but it's easier to contain. Okay, that is not the situation we have right now as we assess it inside of the task force. what we have inside the task force right now is what we're calling community spread. Okay, and the community represents potentially off-post, all right, or on-post, most likely within our formation. So when I talk community spread, I'm talking that which we bring back with us to Fort Benning from off-post. So as the state of Georgia and Alabama has opened back up, as we're getting back out to interacting more in the public, our risk for exposure has been increasing. And now we're starting to see the effects of that. And so while I have a bunch of different dots up here, I just want to be upfront again that this is not actual numbers right now in the task force. It's just a graphical representation so I can kind of explain how we're seeing the problem. And so each of these kind of blue silos here is supposed to represent a company. And again, just graphical, it's not all 8 companies. But I want to kind of show you what's going on. So, there may be there's like one company out there that maybe has one case, right? And that one person has not interacted with any of our other known positives. Okay, so the only thing, and then based on the trace reports that we run after every soldier tests positive, we look at, hey, where have you been? Who have you interacted with? Those types of things. And I would call some of these cases that are these kind of single cases, what I would say is normal pattern of life, right? I went to Walmart and I used the pickup, the new process. I went to the commissary, but I wore a mask while I was in there. I went to the shopette, but I wore a mask while I was in there. And here's my small cohort of soldiers that I interacted with. Okay, so very difficult, very challenging to determine where that soldier potentially picked up COVID. We got a couple instances, or an instance of one soldier in one company who was hanging out with a soldier in another company, and both of them tested positive, right? So pretty easy to make that correlation when you see these kind of double dots together. It was pretty easy to determine likely one of these two soldiers gave it to each other. And I would say just because a soldier tested positive first doesn't necessarily mean that that's the soldier that had it first, right? It could have been the other soldier who was asymptomatic, wasn't showing any symptoms, etc., and they had it, didn't realize it, gave it to their fellow service member. That service member became symptomatic first, went and got tested, say I hung out with this other soldier, and then he or she got tested, and now both of them are positive. But I don't want to say just because the first person who gets tested was truly the first person who was contracted COVID, right? And then, we got one interesting situation in one of our companies where we've got multiple positives. In one case, it's pretty easy to see because two soldiers interacting in close contact and cohabitate together. So, okay, it makes sense. All right, but even amongst that company, there's other soldiers that have returned positive. However, they've not interacted with each other, right? So what that tells me is it's not a cluster, right, where it's a cohort or a small group and we got 3 or 4. It's numerous cases. It's a couple cases inside of one company, but all those soldiers are not interacting much, if at all, with each other. So again, that's what leads us to believe that what we're facing right now is community spread. And so we're going, soldiers are going out there, and again, we're running those trace reports, and hey, and it's like normal pattern of life stuff mostly. It's still, hey, I went to the Chick-fil-A drive-thru, I went to the gym on post, I went to the shopette, but I was wearing my mask. I was wearing my mask at the commissary. I did go to one of the grocery stores off post. I did go to, let's say, a Best Buy or something else, right? And I didn't wear a mask while I was inside. Okay, so still very challenging to determine where they potentially picked that up. So that brings us to we've got the enemy now, COVID-19, in our formation. Okay. And we've been playing a lot of great defense for the last couple of months. We were riding 0 cases from April up until last week. So that's a direct reflection on our soldiers and our families doing the right thing, right? But it's also a reflection that our local community numbers weren't really growing as rapidly as they are nowadays. Back in that time frame, I can remember checking in and seeing 3 or 4 new cases a day, maybe in Muskogee County, as I followed the Georgia numbers. But now we're into I think over 1,400 cases just in Muskogee County. So obviously, with the rate of growth in our local area and with our interactions off post, a higher risk of bringing that now back into our formation, right? So really, the question now we ask ourselves is, how do we get back on the offensive against COVID-19? So just no change from back in March, right? The number one responsibility and one of my top priorities as a commander is the health protection of our soldiers and our families, right? That's still paramount. So as we look at how can we get back on the offensive against COVID-19, there's really two approaches we're going to take here. All right, first, we have to limit our exposure to the enemy. Okay? Same as when we do live fires, right? When we do buddy team movements and everything else. I'm up, he sees me, I'm down. Right? I'm up, I'm exposed, and I'm back down. Okay, well right now we're exposing ourselves every day off post in our communities based on everything that's been opening up, and we're seeing now the effects of that. Okay, so based on that, I am reinstituting inside the task force minimum readiness manning and restriction of movement. Okay, so we're going to go back to a similar to GO number 1 restriction of movement, where if you live on post, you're restricted to staying on post. You can use all of post services. You can use the gym, you can use the pool, you can use the library, right? Because Fort Benning as a whole and our institutions, our MWR, has put measures in place to help mitigate spreading that. And those same mitigation factors aren't necessarily being employed off post. And the number one thing that we're doing better on post than we're seeing off post is the wear of masks, okay? Which, as a reminder for everybody, the wear of masks in enclosed spaces with people you do not cohabitate with is required both on and off post. Let me say that again. The wear of a mask on and off post in an enclosed space, a vehicle, a building, etc., with somebody you do not cohabitate with, i.e. your roommate or your family members, right, is a requirement. Okay, on and off post. So for the restriction of movement and the minimum readiness manning, I'm going to take this out through Monday, July 6th. That's going to give us 11 days to stop the potential of spreading it inside of our formation and to limit our ability to contract it from interacting with off post. Okay? So this restriction of movement and limiting our interactions, and you can kind of see I put the little sad face up there, right? This is not a decision I wanted to make, but I felt it's a decision I have to make for the health protection of our soldiers and our families. And it's not lost on me that as we go into the one weekend, the one holiday that celebrates our independence and freedom, that I'm putting in measures that restricts our personal liberties and freedom. It wasn't a decision I made lightly. Much deliberation and thought went into it, and lots of second guessing of myself, if I'm being truly honest with you. But I absolutely believe that this is the right thing to do for the health protection of our soldiers and our families. So this restriction of movement, minimum readiness manning, and limiting our interactions off post is our short-term solution, right? We gotta almost kind of put the tourniquet on and stop whatever bleeding is going on right now. But let me shift for a second. Let's talk about the long-term solution. We have to now internalize our new PPE and sanitation kind of posture and process. Okay, we've not been doing as good a job as we can be doing that. And I had as I was kind of talking to my daughter this morning over breakfast, she had made a very interesting comment. She says she had saw in an article somewhere and talking about how America's dealing with our new changes. It takes 21 days to build a habit and 90 days to change a lifestyle. And I thought, well, that kind of makes sense as to where we're at right now. So the habits that we're not truly internalizing yet is the minimum 6-foot separation, right? And putting those masks on in enclosed spaces, or even if you're not enclosed, but you're going to be within that 6-foot physical distance. Okay, we're not there yet. And so part of this 11 days of minimum readiness manning and restriction of movement is so that we take a little bit of time to recognize we got a problem, re-energize ourselves, and we're going to do some re-education as well. Most of the platoon should have already gone through this, but re-educate what the current CDC symptoms are and start to internalize the habit of pulling your mask out of your pocket, putting it on your face as you're going into a building or as you're going into a car with somebody who's not your roommate, not your family member, etc. This is going to be the long-term solution to this problem, right? We have to change our lifestyle. And as my daughter mentioned this morning, 90 days. Well, General Order Number 3, which dictated mask wear, came out in mid-May, May 24th, I believe. It was mid-May, right? Directed the use of masks. And unfortunately, every day, I would say since then, leaders are out there making on-the-spot corrections because we're not doing the right thing, and we're not doing the right thing with physical separation. So we have to internalize this new way of life, and when we come back from this 11-day minimum readiness manning and restriction of movement, we have to demonstrate through individual accountability and through leader spot corrections that we are starting now to internalize this new lifestyle. Obviously, we've said, hey, you still got to wash your hands frequently. That no change there. Although some additional research says that it may not be as contagious off of surfaces as we initially thought, but still better to be on the safe side. And then with that, right, things that we use, barbells, kettlebells, things to work out, equipment, right? The mentality has to be, I'm going to sanitize this piece of equipment, this barbell, this whatever, before I use it. Why? Because that's the only time you can guarantee that that's 100% clean. We can say, hey, after you use a barbell, you should wipe it down, right? But I've seen too many instances of soldier finishes doing something, puts something down or puts it back away and walks away, right? So how do you know 100% that that kettlebell, that barbell, that radio, that hand mic you're about to use is clean? Is you cleaned it. So clean before you use a piece of equipment. Hey, I understand this is going to be disruptive. We don't make big changes like this lightly, and as we spent many hours late into the night last night working through this with members of the staff, we fully recognize there's situations out there that we don't necessarily know exist, and we're going to find out about in terms of disruption to soldiers and families' lives. So first I'm going to ask you to work that through the chain of command. You can still obviously use the Task Force 128 questions Gmail, and we'll post that up again. But if I get a flood of 20, 30, 50 emails, it's going to take a long time to get through those. So what I've asked the company commanders to do as we communicate this is start to find, hey, what are those eaches out there, or those unique situations that we need to take a hard look at. I'll just give you one example. Summertime for some of our soldiers who are single parents, and the child lives with the ex-spouse. I know I've signed a few leave passes for soldiers to go pick up their child for the 2-3 weeks that they're going to have them for the summer, right? So I know that there's going to be some of those situations that exist out there, and I'm sure there's a lot more that we're not thinking about. So, hey, think about COVID-19. It's an enemy. It's penetrated our defenses. We had good defenses for several months, but it has now penetrated and infiltrated into our formation, right? And so now we need to take these next 11 days to solidify our defenses, right? We need to start building that habit of the physical separation and the wearing of masks in enclosed spaces, right? And that's what's going to help keep our family safe, keep ourselves safe, and then very shortly, coming off this restriction of movement and minimum readiness manning. I'm sure one of the quick questions is going to be about block leave, right? Still scheduled for July 11th to the 26th, and as it stands today, we are still abiding by General Brito's 75-mile restriction. I do believe that that's being looked at. However, I would not make plans for that mileage rate changing. But if it does, even if it changes, if it maybe happens to change July 10th to, let's say, 100 miles or 200 miles, etc., and I'm not saying that's what's going to do, but if it does change the day before block leave, yes, you will then be allowed to go out to that mileage limit. Okay, I'll just say my hope is that by taking the next 11 days to re-educate ourselves, start to internalize the PPE process, the physical distancing, demonstrate that we can do those things, have leaders that can demonstrate they can enforce the standard, right? That we will now have a new habit that's building towards a lifestyle, so that when our formation, those that choose to go on leave, they're doing the right things inherently. I kind of liken it back to soldiers, when we've deployed before. I can remember, the first time you deploy, and in those first couple of weeks, you might, walk out of your housing area or your office, and you left your weapon at your desk, and you got about 10, 20 paces outside your office or your living area, and you kind of had that oh crap moment, and you turned around and grabbed your weapon because you forgot it, because you hadn't been used to having it with you 24 hours, right? And on the backside of that deployment, for those that have lived this, right? Can you remember the 1 to 3 weeks when you got back and you're in your jeans, you're in your t-shirt, you're hopping outside your house, you get in your car, getting ready to pull away, and you kind of have that oh crap moment because you realize you don't have your weapon, but you realize, oh yeah, I don't need my weapon because I'm back in the States, right? It's that habit, it's that lifestyle now that I want us to start to internalize of, whenever I'm around somebody, I'm always being active and maintaining a 6 foot separation, even if by human nature they're trying to kind of shuffle towards me to get within that 6 foot distance, because that's kind of human nature, right? And I want that habit of, you always have a mask on you in your pocket or whatever, in civilian clothes and uniform, etc. And hey, I'm walking inside, boom, it's like a battle drill. I put my mask on, I'm inside, I take care of business, I come back out, I can take my mask off, get back in my car and drive away. So, short-term solution, we're going to go back to that restriction of movement, right? Long-term solution, we got to change our lifestyle. I am 1,000% confident that our soldiers can do this. And I'm strongly encouraging our family members to also internalize this new lifestyle, because it's not going to be going away for a long time. I'm extremely proud of our response, and extremely proud of the 98.7% of our soldiers that did the right thing through the last couple of months. And I know that we can do this again. I understand it sucks. It's not a happy decision that I made. It's not a decision I made lightly, but it's a decision I made for the health protection of you, our soldiers, and our family members. So I ask for your continued support, and please get out there and hunt with the pack.